Woohoo! Welcome to 23 Degrees Sideways. Let's talk about the virus and the vaccine and all the crazy crap and the masks and this and that. Obviously, we're living in a world where there are some very significantly different viewpoints. And, you know, I look at someone like Fauci or Newsom or Steve Sisolak or one of the other fear mongers, and I literally they exist with a reality that denies reality. Like, they literally, you can show them Lake Havasu, 1 million people, Memorial Day weekend, no masks, no super spreader, and they literally cannot process that there is no super spreader. They change the definition of a super spread event. They change things around, and they manipulate, and they manipulate the perception such that they can still justify this idea that everyone has to wear a mask or two masks and a face shield and a plastic barrier between you and them with disinfected surfaces, all sorts of stuff. And it's all necessary to stop the spread. You know how that morphed over a year from slow the spread, you know, make it, this is going to hit everybody. We're all going to get it. It's fine. It's very survivable, but we want to make sure that the medical system doesn't get overwhelmed. So we're going to, you know, pause things for a couple weeks and just make sure the curve isn't too bad. That went away. Okay, the moment they got a taste of power, the moment they got a taste of that reality manipulation, it went completely out the window. It's no longer even a topic, okay? It's eliminate. And if we can't eliminate, then we're going to have to live without freedom forever because of the killer evil virus. Oh, why? Okay. Thor's left nut, man. This is so stupid, right? So now we have several vaccines, all of which are contraindicated in large numbers of the population for various reasons, all of which have limited but severe, deadly side effects. Very limited, okay? Very, very limited. It's kind of you can flip a coin over whether the J&J vaccine or COVID is more deadly for you because the survival rates are really pretty similar, right? Someone's going to argue against that, and I don't care. Long-term effects, we don't have a whole lot of information on long-term events. There's a medical professional who I know very well who tried to scare me a couple months ago with there was a Children's Hospital of Philadelphia report that, you know, all these kids, there was exactly 50 kids who were in this hospital who then tested positive. So they're already sick. They're already in a hospital. They're all in the same facility, and they test positive for COVID, and they all have a blood platelet disorder. And it's a common disorder during surgeries, certain types of hospitalizations, and it's temporary. So this medical professional tries to convince me that if my kids get COVID, catch COVID, get infected with the virus, even asymptomatic, they will have a lifelong blood disorder disease. Which is just absolutely not true. If you're an intelligent listener, you've already said, hey, wait, why is the sample size exactly 50? Why is this all kids who are already in the hospital? And why is it all the same hospital? Like, there's some pretty big confounders here. Like, what is it about this hospital that all the kids, you know, notice there's no reports on kids who didn't test positive, right? Why is it that all the kids that we have any data on from this hospital have this same temporary condition? Ooh, big question, right? Anyway, so all the fear-mongering aside, it turns out that we have the potential for lifelong blood disorders from some of the vaccines, which is way bigger a risk than a kid having a temporary platelet disorder because they're in a hospital. Wow. Talk about levels of insanity here, right? I don't want to dwell on it too much because it just, I don't want to feel bad about this person, right? I realize that it's not the person trying to fool me, it's the program that the person is possessed, ideologically possessed. That's just, it's part of how things work right now. So we still have we have a virus going around, and the virus is related to common other viruses. We've done this before. This has gone through several cycles. We're just better at identifying strains every year. That's just part of life, right? Part of the development of technology. And we've hit this wall where we've got the first time where Western society, the classic, I want to call it the late boomer society, the sit on a couch eating potato chips, watching television for 6 or 8 hours a day as your recreation after you sit in an office. That change, that shift, the no sunlight, the no skin tone, no tan, no tanning. People don't even do tanning beds half the time. They do spray tan. What the hell? Okay, we've shifted our society, and a lot of society has shifted that way. Europe, the richer parts of Asia, a lot. Okay, it has become big. So this last, 30, 40 years has seen a fundamental shift in how humans live that is such that it changes how we perceive, how we are affected by things. We're talking about a virus that you probably would not have ever even noticed a century ago. Okay? Literally, it would have landed, it would have hit, it would have spread, and no one would have noticed. Because people walked, people were outside more. It's amazing how very different our lifestyle is, and how much of an effect that this could have. People downplay these reports. You get these reports about how the virus doesn't cause the syndrome. COVID is a syndrome. SARS-CoV-2 is a virus. But the virus either doesn't spread or doesn't cause the syndrome in populations that are outdoors, that are healthy, that move, that have sufficiency of certain vitamins and minerals. People say, oh, well, yeah, healthy people are healthy. No, it's way beyond that. It's way beyond lowering your risk. It's eradicating, okay? There's nothing there if you're out in the sun and you walk. We're not talking going to the gym and exercising. We're talking walking a couple miles a day outdoors. You know, appropriate weather. You're not going to die if you miss a day because of a snowstorm. I mean, people try to make this into something that is impossible, while at the same time downplaying it as something that's too easy and doesn't have a great effect. You know, this is just mental games. If you walk, if you have a tan line on your sleeve, on your headband, wherever, if you have a tan line and you walk, you just move your body through space, you're fine. It's really that simple. Obesity is not a big deal. Obesity is one of those things that is an effect. It goes along with a lot of other problems. It's not the problem itself. Someday I'm going to sit down and do an entire 20-minute video on that one. But I keep coming back to the topic, okay? Obesity tends to be a result of medications, lifelong stress, chronic stress, program switches. Certain people just have the right genetics, okay? It's not that you have obesity genes, it's that you have genetics that turn on and off in the presence of a very high sugar environment when you're a baby. I've seen this with a child of my own. I've seen where a family member completely ignored all of our child rearing rules and gave a 7-month-old baby a bowl of ice cream and fed it to her. And you could actually watch it. I watched the brain chemistry change, okay? You may or may not believe that. You may or may not have any concept of that if you've but you could see it, okay? There was a change in the baby with that one, and it's been a constant struggle with sugar, sweets, syrups, and stuff ever since, okay? Because it's an addiction. It's an early form addiction. And we know this, you know. McDonald's can addict a baby, an infant who's never tasted a French fry, to French fries through their marketing, the smell, the family, we know how this works. Marketers know how it works. Most libertarians will deny that it exists. That's one of the really funny things to me about libertarianism. Got to get my dig on the hard L, the capital L libertarians here. They deny that psychology exists. It's really funny. You know, oh, well, maybe in an extreme situation, some sort of psychological conditioning could control somebody, but it's all about free will. I'm like, it is all about free will, but it's all about being able to have free will, and it's really easy to take it away from people. So, back to the virus. Virus isn't deadly. Virus may or may not actually cause the syndrome. I mean, the thing is, there's enough variability that we're not even sure about that. It's an assumption, but it's not something, and it's falsifiable, but it's not something that has been researched enough to actually say, yeah, we're pretty sure of that, you know? No one's actually looked at it. You have to ask the question and do the research, not just make the assumption. It's like Dan, the guy on who I've had conversations with about masks. They just make sense. It's common sense. No, it's not. There's no common sense. We have lots of data indicating that masking has no effect on spreading flu or stuff. People say, oh, what about the operating room, the OR? I'm like, okay, yeah, masks help prevent gross particles. That's large particles. That's not viruses, but stuff like spittle, the chunk of tartar that just came off your tooth, the meat bit from your lunch, the hair from your mustache. It keeps that from falling into an open wound while you're in a surgical theater. I get that. That's different. The difference in scale that we're talking about with the asepsis movement is dramatic. If you were to do a true to scale, okay? True to scale, so a virus is this big, okay? The size of the spittle particle, the food particle, whatever, the aerosolized water droplet that virus is sitting on is going to be bigger than this truck, bigger than a semi-truck. That's the difference in scale that we're talking about, okay? But people think masks, which will pass semi-trucks in this context, or at least the truck, maybe not the semi. That's where you're getting into the protective value. Have anything to do with these? No, they don't. Oh. So, here's the rant, if you're still here. Health has more to do with the spread of the SARS-CoV virus and the incidence of the COVID syndrome than any medication, any lockdown, and anything else that we have. General health has the biggest effect. That general health being defined as movement through space, walking a couple miles a day, and getting enough outdoors time, outdoors air, sunlight, to have a tan line. Okay? Pretty much just about that. That's where it is. People talk about vitamin D sufficiency, and they talk about the D3 precursor, which is converted to the hormone. Vitamin D is a hormone, not a vitamin. In your kidneys, provided you have proper kidney function, there's a form of it that'll convert in the liver, but the best way to have vitamin D sufficiency is to have a tan line. Oh. It's all, and that's another thing. It's all hormones all the way down. People really don't understand hormone chemistry or the hormone theory of health. People really don't like hormone systems, and that's part of the problem. Is their systems. You can't just say, "Hey, one hormone." There's dozens of them. They all work together. It's a complicated mess of squishiness. And people really don't like things that include more than one variable. That's just, people are trained to think in terms of one linear variable, and that's just part of the way our education system has decided to program people. It makes for better servants of industry and the state if you have someone who follows one train of thought, single line, single variable, do this, then do that, And there are places where it's appropriate, but it's really not appropriate in trying to understand human body systems. Or, obviously, coronavirus. So now we have a bunch of vaccines that may or may not be effective for various terms, and the data is still unclear based on the timing of the vaccines, whether or not they're having any actual effect on the number of cases and the spread of the virus. All of which have potential or provable side effects that are bad, okay? Not good. We have a system of masking and lockdowns that has destroyed lives, caused suicides, increased homicide rates, driven people up the frickin' wall, and, in many cases, demonstrably increased the spread of the virus. Or the effects of the virus, the spread of the syndrome. Okay? Key phrase here. It increased expression of the COVID syndrome in lockdown environments. Nothing that they've told you is good. Nothing that they told you is right. Nothing that they've told you is accurate. And it's a little bit hard because, like Dan says, masking is just common sense. It's not. It's not if you look at the data, and the data is pretty obvious. Data's there, but it doesn't. It's one of those things. Well, it can't hurt. Maybe not. I can argue that. I can argue that from a psychological perspective and tell you that you're destroying children's lives. It's child abuse. It's certainly not doing any good. And then people routinely, reliably ignore the things that we know work. Okay? You can go to the feed store and get some ivermectin for your horse, right? And apparently, I'm not suggesting you do this. I'm not suggesting this has ever happened. But apparently, there's some use for that is therapeutic for the COVID syndrome or the spread of the virus. I don't even know because I don't worry about it, right? There's the hydroxy whatever the hell it was, which also seems to have some pretty phenomenal effects in other countries, but not in the United States, because we deny it in the United States. But the biggest thing of all, and the biggest one that people ignore, is just sunlight and movement. And, people hate it. The idea that if you just live like a human, instead of like one of those chair people in the Wall-E movie, is that what it was? Whatever. The red chair people, it all goes away. People literally cannot handle not living in fear. What the hell? So this is your weekly virus rant. No one's going to take it down off the internet because no one's going to watch it. But that's how I'm feeling about the virus right now. Stay sideways and go get a tan line.